Thank you for joining us for a conversation around the current state of coronavirus. This is the first of two webinars where we will discuss information as it relates to the spread of the disease, vaccinations, and other pertinent data that can be used to help you in your day-to-day interactions. My name is Carrie Davis. I'm the director here at Mount Zion Community Reinvestment Corporation in Albany, Georgia, and I have the pleasure of being joined by Dr. Grady Thompson, physician with Phoebe Putney, to discuss the current trends and important things to know. Welcome, Dr. Thompson.
Thank you. Hosea 4:6 said, "My people perish for lack of knowledge." So knowledge is what I hope to bring to you tonight concerning this disease called COVID-19. We know that things are looking a lot brighter. People are not wearing their masks. Places that used to require masks are making it optional or not requiring it at all. But just to give you an idea, as of December of 2022, there were 282,827 new cases every week, bringing the total cases thus far to 102,736,819. Of those, there were total deaths so far of 1 million people, 110,364, with 3,171 deaths occurring weekly. That was as of December 2022. The current hospitalization is 21,442 people still being in hospital for treatment of COVID infection. 11 of those are currently at Phoebe Putney Hospital. In order to discuss a topic, I think it's important that we get some background information. At the end of 2019, there was a new coronavirus that appeared on the scene and identified as a cluster of pneumonias that occurred in Wuhan, China, and rapidly spread it, resulting in an epidemic in China. In February of 2020, the World Health Organization designated the disease COVID-19, which stands for Coronavirus Disease 2019. The virus that causes COVID-19 is the SARS-CoV-2 virus, which means severe acute respiratory syndrome COVID, coronavirus 2. This is somewhat of a misnomer. First of all, it starts out say severe, whereas we know that a majority of the cases are not severe. Most of the cases are mild. Then we have moderate, severe, and critical. But the severe part makes it somewhat of a misnomer. The second thing that makes it somewhat of a misnomer is respiratory. We know that this disease does not only affect the respiratory system, which includes the sinus, the pharynx, the airways, and the lungs, but it can affect any organ system in the body. So diseases, the spectrum of those who are asymptomatic has been well documented. In fact, this let us know that we have no idea how many people have been infected with this virus because asymptomatic people don't go get tested. They don't think there's anything wrong because they have no symptoms. But the patient, most people, the people who are symptomatic usually have very mild symptoms. The main ones are headache. Most people don't, only half of the people even have fever, but most of them are, like I said, headache, muscle ache, in some cases fever. Whether or not a patient gets severe illness have many factors to consider. Age, underlying comorbidities, in other words, whether or not they already have some illnesses, like high blood pressure, diabetes, cancer, or other forms of illness. And then the infection rate, which is the estimated mortality rate among all individuals, is considerably lower in those who have been vaccinated as opposed to people who have not been vaccinated. In fact, in a hospitalized patient, the risk of critical illness is proportional to those people who have not been vaccinated. Very seldom do we have people dying from the disease who have received their vaccination, but they will still have sometimes severe illnesses, but not critical illness. Vaccination against COVID-19 substantially reduced the risk of severe disease, and is also associated with a decrease in the death rate for people who do get the vaccination. Another factor in determining the severity of the disease is physical activity. Morbid obesity is a major cause of severe illness and even critical illness in people who contact this disease. Sometimes socioeconomic background plays a part in that. People in this area sometimes are not able to get to the facility where they can get help. The good thing about this disease right now is that the services for testing and treatment are free right now. So the main factor that people may have now is getting to the place. The incubation period on this disease is generally within 14 days following exposure, but most people will start having symptoms in 4 to 5 days. So if you get exposed to it, you may look to start feeling bad 4 or 5 days later. So you can kind of trace back to where you may have been or who you may have been in contact with when you caught the disease. But you can be up to 2 weeks before you start having symptoms. With the Omicron variant, which is one of the coronaviruses that's causing this disease, the time is usually a little shorter. They usually start having symptoms around 3 days. As I said, people who are symptomatic usually have cough, muscle aches, and headaches. They can also have sore throat. They can present with diarrhea, smell or taste abnormalities. But pneumonia is the most frequent serious manifestation of the infection. Fever is not a universal finding. In fact, in hospitalized patients even, there's usually less than 50% had fever as a presenting symptom. They may develop it later on during the illnesses, but most of them, like I said, only half of them had fever to start with. Some patients who usually have non-severe symptoms may progress over the course of the illness to have severe symptoms. That's why just because you don't feel really bad when you first get it, you still need to take precautions. You need to isolate, not only for yourself, but also for those who are around you so that you don't spread the disease. As I said, respiratory problems is the major cause of critical disease or serious disease. Pneumonia, what we call COVID pneumonia, is difficult to treat, but there are options out there and most people with this are what we call hypoxic. In other words, they have a low oxygen count. So if you want to really check things out for yourself at home, you need to have your pulse oximeter, which you can get at any pharmacy, to see how much oxygen you have in your blood And if it drops below 90, you need to go somewhere and see somebody. Other things that it can cause cardiac problems, arrhythmias, heart failure, heart attacks and all that. It can cause blood clots in your legs and in your lungs, both in the veins and in the arteries. So, like I said, that respiratory is a very misnomer for this disease. It should be named all-encompassing coronavirus. We also must remember that the coronavirus is a member of the class of viruses that cause the common cold. The common cold virus is a coronavirus. A lot of people don't realize that. And the time to recover from COVID-19 varies. Depends on the age, vaccination status, pre-existing comorbidities, in addition to the illness severity. In other words, the more severe the illness, the longer your recovery is going to be from the illness. Many individuals with severe disease usually recover in 2 to 3 months, but some people takes a lot longer than that. And some people that are being followed now are still having symptoms, and we're talking about 2 or 3 years down the road. So we don't know how long completely that this will be. Another thing we need to look at is treatment of the management of the adult with illnesses, outpatient management, which is something most people need to know about. There are certain outpatient management is appropriate for most patients with COVID-19. Anytime a patient come up positive with COVID, they think they need to be hospitalized. But that's not the case. In fact, we don't, at my hospital, we don't even test everybody that comes through the emergency room before we admit them. During the pandemic days, if you came to the emergency room, before you could go to the floor, you had to have a COVID test, because we were only putting you in certain areas of the hospital. But that's not the case now. Now, unless you have symptoms that the staff think may be related to COVID, we don't even COVID test anymore. Now if the patient requests it, most times they will get it. We can't have the test done. The primary objective in evaluating a patient, whether or not you need to put them in the hospital or whether you can treat them outpatient, is the severity of their symptoms, the safety of their home setting for being treated at home, the appropriateness of the therapies that we have for COVID now. In the outpatient setting, COVID, the main thing we've had to come up here recently is to treat them with a drug called Paxlovid. That is recommended for people who are symptomatic only. Asymptomatic people, even though they test positive, we don't recommend that this drug be used, because more than likely, just like with the common cold, if you don't even take anything for it, you're going to eventually pass the treatment. You're going to pass the acute phase stage and not need any treatment. But those that we recommend are people who are greater than 65 years of age, regardless of their vaccination status or other risk factors for severe disease. In other words, if you're over 65 and say you run the marathon every year, you can do the treadmill test and wear out the machine. If you're over 65, you still need to go get vaccinated, regardless. And adults of any age who have a compromised immune system for any reason, whether they've had a history of cancer, rheumatoid arthritis, things like this, inflammatory bowel disease like Crohn's or stuff. These people also have compromised immune system that a lot of people don't realize, because these are immune-mediated diseases. There's something wrong with their immune system, the reason they get these diseases. So they need to also, regardless of their age, they need to get it. And adults of any age who have multiple risk factors, say they got diabetes, high blood pressure, obesity, heart disease, regardless of what their age, we recommend that they get them. And any adult over 50 years old who is not vaccinated should receive the vaccination. Now, as I said, the treatment with this new drug is called Paxlovid. It comes in two different sizes. It depends on whether or not you have kidney issues or liver issues. If you have problems with your kidneys, you take the half dose. But if you don't have any problem with your kidney or liver, you take the full dose. But the thing is that it does interfere with a lot of other drugs. So you need to talk with your pharmacist or your physician before you start taking these medications to make sure that you're not causing a higher risk to your health by taking the medication. Okay? As I said, there are a lot of other medications out there that's being considered for treatment. Like when we first came out, hydrochloroquine, Vimectin, and a lot of other things were considered the thing to do. But we found out that none of those things work. They don't work, and they shouldn't be used because there are no tests to show that they really help. Now, there's another drug called remdesivir that we use now. It can be used in the outpatient setting, but it has to be administered intravenously. So that can cause a problem for outpatient. You have to take there's 3 doses 1 day apart. If you got an infusion center somewhere in your community, which is not going to be, available in a lot of communities. So that most of them have to either go with the Paxlovid or be hospitalized for the remdesivir. But right now they're working on a remdesivir tablet that hopefully will come out soon, that we will be able to prescribe for patients and won't have to have the shot injections. So that's a lot of stuff is in the pipeline as far as treatment. Also, there's a lot of different things coming on about the vaccinations. Speaking of vaccinations, everyone over 6 months should receive the COVID vaccination. People I don't know why, when you got something that proves it's beneficial for the community, not just for you, but benefits the whole community, why wouldn't you take it? Especially when they talk about the amount of time they put in with developing the vaccine, because most vaccine take a long time to develop. But it has been shown that the development of this vaccine was accelerated, but it did not take any shortcuts. They went through the same standard preclinical and clinical stages of development, and safety was the #1 criteria. They were very strict about making sure that it was done properly, just like any other vaccine was done. In the United States, we have 4 different vaccines. We have the Pfizer, the Moderna, the Novavax, and the Janssen Johnson & Johnson vaccine. Now, these different ones are called, one thing about vaccines, we have what we call a monovalent vaccine. That means that it's protective against just one strain of the virus. And then we have the bivalent vaccine, which is protective against 2 strains of the virus. Right now, the recommendation is for 2 of the monovalent shots that should be given for anybody from 12 years up can take the Pfizer, but they got what we call the emergency use authorization, where children from 6 months to 12 years are also authorized to take the Moderna and the Pfizer vaccine. The other vaccines, especially the Johnson & Johnson, is really reserved for people who don't want to take the Moderna or the Pfizer, and you have to be at least 18 years old to take the Johnson & Johnson vaccine. Vaccine availability in the United States, the vaccines are highly effective. Substantially reduce the risk of COVID-19 infection, and especially in severe critical disease, have been associated with reductions in hospitalizations as well as death rate. People who do not have the vaccine, with or without the booster, have a high mortality rate and a high rate of hospitalization. Pfizer and Moderna main side effect, sometimes what we call adverse effect, could be myocarditis, which is inflammation of the muscle of the heart. Sometimes with the other vaccines, you can get, like I say, Guillain-Barré syndrome, but all of them can cause an allergic reaction. That's with any medication you take. There's a risk of getting what we call an allergic reaction to the medication, and sometimes what we call an anaphylactic reaction, where it can actually cause death. But you don't. The rate with these are no higher than it was with other medications that people take. So that's, there's a lot of specifics about taking the vaccine that probably don't really need to be discussed right now, but the main thing is get your vaccination, wear the mask when you think you're around somebody who's been exposed or potential exposure, keep your hands clean, and follow your doctor's advice.
All right, that sounds wonderful. So there's a few questions that are out there that I'm going to ask you. And the first one is, President Biden intends to end the COVID-19 national and public health emergency on May the 11th. That means that many Americans could have to start paying for COVID-19 testing and treatment after the declaration cease. So what is your advice to the community now of what they should be doing before the cessation of the public programs?
A lot of things they need to do. Things that are very obvious is get vaccinated. Get vaccinated where right now you don't have to pay for it, and it can be a lifelong benefit for you. Another thing is all these free home tests that they have now. Don't stockpile, but stock up on them.
Right.
Leave some for other people, but get your share and keep them at home so that if you think you need to be tested and they're no longer doing them free in the community, use your own home kit. But the biggest thing they can do is, until this disease is really under control, which the statistics I just showed you, people think it's a lot better than it is. Talk to your congressman. Talk to your representatives. Get them to see that it may need to be extended, because I mean those are the only people who can really extend this thing, the free care. I mean, it hadn't broke us yet, right. So I don't think it will break us. So talk to, like I said, talk to your representatives and your congressmen and see if they can persuade the president to not cut this thing out May 11th. At least give us a little longer till we get a little better grip on this problem.
So what is your recommendation right now to people who are out or who are going out into groups? What precautions should they still be taking even as the numbers change throughout the community?
They shouldn't change anything that they're doing. They should still, wear the mask right now until the CDC say, I mean, these are the experts. These are the people we pay to give us guidance. And anybody that can't be guided, they're in for trouble anyway. You got to be able to listen to the people who know what they're talking about and follow their recommendations. They have the knowledge, they do the studies, they know what's out there and what's going on. So if they say still wear the mask, wear the mask. Like especially if you're in a big group, 2 or 3 people, you might not need a mask. But when you're going in a big group, and the chances of that increases the chance of somebody there being positive.
Right.
And like I said, so many of them are asymptomatic, but they can still spread the virus, even though they're not coughing, they're not having fever, they're not aching, they're not having any symptoms at all, but they got the virus and they can still spread it, even though they're asymptomatic.
So if you are having mild symptoms and you're taking a home test, your home test comes back positive, what treatment do you recommend at home? So if you're at home trying to treat a mild case of COVID.
Okay. What I recommend, what is recommended is what we call symptomatic treatment. Lots of fluids. Isolate yourself from the rest of the family for 5 days. Now, if your disease is to the point or you're in the category where you may progress to severe disease, it's recommended that you take the Paxlovid that we talked about, and then isolate yourself for another 5 days after you finish. So for a total of 10 days, if you have to take the Paxlovid. But if your symptoms are such that you don't have to take the Paxlovid, 5 days is what's recommended for isolation, but you should still wear the mask for another 5 days rather than just 10 days isolation.
So if you're a caretaker, then you should also be taking the precautions of what?
If you're a caretaker of the one,
Mm-hmm.
you should be wearing the mask.
Okay.
You should be keeping your hands clean, even wearing gloves when you're taking care of the individual. Unless, because if they're in a home setting, you don't need all the face shield and the gowns and stuff, because they're that sick, they have no business being at home.
Gotcha.
They should be in the hospital.
Okay. So let's talk a little bit more about those risk factors that you mentioned earlier. So one of the things that you said was obesity. I think you said high blood pressure. So what are some of those risk factors that people need to be aware of?
Anybody who's being actively treated for cancer is a high risk for severe to critical disease. People who've had organ transplants, solid organs, or whether it's just the stem cell, these people are really high risk. And in fact, the CDC recommend that if these people, if they have had the full series of vaccinations as well as the boosters, then they have this procedure done, like transplant or something, they need to do another new series of primary series and boosters after. It's recommended that they start about 3 months after the procedure, that they need to go through another whole series like they've never been vaccinated. And another thing is that people who have, so that they're being treated for cancer or have any kind of immunocompromised state, they need to take a third monovalent as part of their primary series. That's not considered a booster in their case, is they need to take a third monovalent and then still take the bivalent booster in those cases.
So at this point, if you've had 4 or 5 shots, is there a need for another shot, or have you had the bivalent at that point?
It depends on whether or not they gave you the bivalent. Yeah. Some people have had 4 shots of monovalent.
Right.
But you still, because like I said, the monovalent just protecting you against the Delta variant, which was the first one that came out. But with the with the bivalent, you also have the Omicron protection in there. So if you never had the bivalent, you need the bivalent.
Okay. So we're encouraging people to come out and get the bivalent if they haven't gotten it,
Yes.
correct? All right. So there's another thing that's going on, and that's a whole lot of myths around what the vaccine does, what the vaccine doesn't do. Could you talk a little bit more about that? Talk about what it is that the vaccine does and what hasn't been proven.
What hasn't been proven is that you have a higher risk of higher, let me see how I want to say this. the risk of taking the vaccine outweighs the benefits. That's what it all amounts to in medicine. Does the benefits outweigh the risk? In other words, regardless of what you do in medicine, there's going to be a risk involved. But does the benefit you get from taking that risk, is it worth it? And it's clear that regardless of how many cases of Guillain-Barré they have had, or other problems, adverse events, it's worth the risk because the benefits are there.
Well, that's something that we've heard a lot in the community lately is that, I think that this is going to happen if I take the vaccine. And what we've tried to let people understand or let people know is the vaccine does not mean that you're not going to get coronavirus. It does not mean that you're not going to develop symptoms, but it just means that you have a better outcome at the end. So is that the correct?
That is 100% correct. Whereas you may have had severe disease unvaccinated.
Right.
You might have just moderate or mild disease, or even asymptomatic disease if you had the vaccination. The vaccination helps your body to build up antibodies against this virus. So when you come in contact with the virus, if you got the antibodies in your body, it jumps on that virus and keeps it from replicating. That's mainly what treatment of viruses do. Treatment of bacteria, we tend to destroy the bacteria, kill the bacteria. But viruses, what we do is stop them from replicating, keep them from, reproducing. And that's what causes the bad symptoms. The more they reproduce, the more symptoms they cause. So if you have antibodies already in your system from taking the vaccine, they don't have a chance to replicate. So the symptoms that you get will be mild or moderate as opposed to being severe or critical in most cases.
Okay. So is there anything else that we need to make our community aware of in this conversation around coronavirus that we haven't touched on yet?
It's not something we hadn't touched on. It's just that we're not out to woods yet.
Right.
That's the biggest thing. That's what we need to know. We're not out to woods yet. We still need to take precautions.
All right. Well, this has been a conversation with Dr. Grady Thompson, who's at VP Putney. We also want to remind the community that we also do have some upcoming vaccination events that are available to you. These are free of charge, so all you have to do is come out. And we are even providing incentives for those of you who come out and get your vaccinations. Our next event is going to be held on March the 11th at Baraka Fellowship Church out on Cordele Road. It's 1719 Cordele Road. So please come out and join us, and we'll have our second webinar coming up soon. So I hope that this information has been good for you. I hope that you're able to use it in your day-to-day lives. Again, thank you so much, Dr. Thompson, for coming out and speaking with us tonight, and be well.
My pleasure.
I think we can